All right, good morning. I'm so glad that you can make it. Thank you for making the time to be here and join our caring network at One Caring Team. So I'm going to begin with a story. 2 years ago, I got a call one day from Anne. And Anne said, Dr. Kim, I need your help. Okay. Dr. Kim, I need your help. My mom, and she started to cry. Betty is 88 years old. She's in a wheelchair. She lives in an assisted living in San Jose, California. She ended up in the emergency room 3 times in 1 month. And she got admitted to the hospital twice, all in 1 month. So I asked Betty when I made the house call as a physician, Betty, why did you stop eating and drinking water? And she said to me, Dr. Kim, I don't matter anymore. Nobody calls me. No one cares about me. Why should I eat? Why should I drink water? My husband died 2 years ago. My son died 2 months after I moved here from Connecticut. My money doesn't call me. So I just wanted to end this. That was her story. So I spent 2 hours and 10 minutes with Betty, and I listened to her stories. And I promised her that I will do something about this silent epidemic in the US, social isolation in seniors. That's why I started One Caring Team. It turns out human connections matter. Yes, we need food. Yes, we need shelter. We need clothing. But after our basic needs are met, we need to have sense of belonging. We need to have friends who care about us. Well, what happens when your friend starts dying because they're getting older and they have cancer and they have terminal illnesses? What happens? All of your friends go. What happens? You're 90 years old and you're the only one left. Is it easy for you to make new friends? Not that easy. That's why we're here. So, if we go to Hawaii, we have wonderful caring families. If we go to mainland, well, maybe the story is a little different. Many of you are from mainland and now living in Hawaii, so you know what I'm talking about. So that's why we're here, because we have identified a gap between family and friends, home care services, and doctors and hospitals. I'm a board-certified ER physician. I have taken care of over 40,000 patients in my medical career. I've been in healthcare for 20 years. Most of my senior patients told me that they were lonely. And they wanted somebody to talk to on an ongoing basis. Not just to see their cardiologist once a month or once every 3 months. That wasn't enough. That's why we're here. So, learning objective. All of you all know this. But we just wanted to highlight the complexity that is involved in elder care. And some of you are already nurses, experienced nurses. And you know that it's not that simple. And all seniors have different needs. And we recognize that. And we're here to help. So let's look at some numbers and statistics. Social isolation is not something that everybody wants to talk about because it's a silent epidemic. And yet it's reaching 44 million seniors that we have in the US. And it's costing us over $78 billion a year due to frequent ER visits by seniors. They don't need to be there. So 39 million ER visits by seniors are completely avoidable. And we want to do something about that at One Caring Team. Okay? 17 billion a year is going towards hospital readmissions by seniors who have no social support. So I'm not talking about people who have great family, who check in on them every day. Well, that's top 0.0000 0.00005% of the population. Most people, when they get discharged home, they're going home alone. And they have very little support. And when you have very little social support, it's very difficult to recover from anything. Stroke, heart attack, new onset, rapid atrial fibrillation, you name it. The recovery is much slower because you have no one to talk to and there's no sense of belonging and community. And that's why we're here. We want to address unmet social needs for seniors. Health impact of social isolation. So there are studies that showed if you're isolated and lonely, your risk of developing Alzheimer's and dementia is over 2.5x, meaning your risk is double the risk, more than double the risk of developing Alzheimer's and dementia if you're lonely and alone. Okay? High blood pressure, your cortisol level is higher if you're lonely. So these are physiological changes one would see when they're feeling alone. So if you have a mom or dad who live far away from you and you haven't seen them since last Christmas, you might want to think about giving them a call. Or you could always sign up at One Caring Team and we'll call them for you. So what is loneliness? Take a minute to think about it. You don't have to be a senior to feel lonely. I have colleagues who have confided in me and told me that they're lonely. And they're educated, successful, professional women with 2 kids, married,